So the future, biologics, cell transplants, whether it be autologous or allogenic, we're already doing some stuff with cells from bone marrow and also platelet-rich plasma. Platelets have a great deal of growth factors, and how that applies to these types of injuries. When you get a chronic type of injury, whether it be a bursitis, tendonitis, or arthritis, these things, all three of those types of tissues, the joints and the tendons, they don't have great blood flow. And in order to get good healing, you have to have good blood flow, right? So the problem is by design. We weren't designed with a great healing mechanism for our tendons and ligaments and joints. And so that's why we get these chronic degenerative changes, because they never get a chance to repair. But what we're doing now with cellular transplants and also platelet-rich plasma is we are artificially putting in concentrated doses of your own cells from your bone marrow plus your own platelets. Platelets are filled with growth factors. Those are the first things to go to any wound. When you cut your skin, platelets, that's what aggregates. That's what starts the whole healing cascade. So once the platelet degranulates, it releases about 13 different growth factors to stimulate the whole cascade thereafter. And now with adding your own cells into it, now it has a matrix to work with. So rather than just trying to tell the joint to start healing itself, you're actually throwing some cells in there for the platelets or the growth factors to tell the cells what to do. All right? Now, a lot of that is still in study and still in test, but it's looking very, very promising. And we are able to do some of that stuff in the office already. Anabolic proteins, OP1, GDF5, fibrin sealant. There's a number of different growth proteins that are in the blood that have been isolated out. And I've been involved in a number of different trials where we've been injecting these things into the disc over the past 10 years. And so each one of them has shown a little bit more promise than the next, than the next, than the next. So we're slowly dialing in the science to where it won't be the fountain of youth, but what we will be able to do is to reference back to that disc degeneration transitioning to spondylosis. We'll be able to catch that disc earlier on, inject in growth proteins and cells, and get it to stop. To get it to basically stop it from progressing on to that next stage. This is just a little bit more about stem cells and what they can do. They can turn into a number of different types of tissues. That's where you get it. You get it from the bone marrow and the hip usually. The only problem with autologous stem cells, this is the only main problem, is that in a newborn, the stem cells in your bone marrow are about 1 in 10,000. Then as soon as you're a teen, it drops to about 1 in 100,000. At 30, 1 in 250,000. At 50, 1 in 400,000. Then at 80, 1 in 2 million. So that's why we don't heal as well. That is the most simple graph telling you why we don't heal as well, because we don't have as many circulating stem cells in our system. So what we're going to see in the future is we're going to see banks, all right, cell banks, where you can donate your own marrow. It'll be grown out in culture to where we can make this 1 in 400,000, and we'll turn it into a million, a few million. Then we'll be able to re-inject it back into whatever location we want to, right? Now the other thing will be is allogenic, because at some point, maybe at 80, even if we grow it out in culture, we can't expand it enough to ever be of benefit because there's just not enough there. And once you split a cell line beyond 7 times, you open up to genetic mutations. And so you don't necessarily want to have a cell line that's been split out indefinitely, because you really don't know exactly how healthy those cells are going to be after about the 7th time of splitting. So for those types of individuals that we don't have enough cells, we're going to have allogenic cells. And those are going to be cells that are donated by young, healthy people that they'd have to pay a decent amount of money to get them. And they do already, because we're already studying them. But then you'll be able to get a packaged little vial of 6 million cells, 10 million cells. And so that's what we're working on right now. And so staying active and staying healthy, it's a chess match against time and age, right? It's a thoughtful approach. You have to know what your limitations are. Posture, everyone? Right, good, all right. Get a baseline assessment, know where you stand, get some professional guidance as far as how to deal with it, and drugs when necessary. It's not a bad thing. Tailored exercise program by people that know what they're doing. Activity avoidance. There's just, when you have certain diagnoses, there's going to be certain things that you just want to avoid. And then there's a lot of hope and promise in the future as far as cellular therapies. So thank you very much.